You can expect to take your baby home within, it's not as normal as when if you go to full term, you can expect to take your baby home within 2 to 3 days, depending on how long you stay in the hospital. But when you have a premature baby, sometimes you can go home within 2 to 3 days, but the baby can stay up to 6 months after your birth. Treatment and delivery. Of course, you have doctor visits, many doctor visits. In the first part of your pregnancy, you go to a doctor every 2 months for the first trimester, which means the first 3 months of your pregnancy. Then after that, you start going like every month and a half for the next 3 months of your pregnancy, which is the 4th through the 6th, 7 months, something like that, depending on where you're at with doctor. It depends on the doctor, basically. Then after that, you start going to the doctor every 2 weeks, from this 7.5 to maybe 8.5, 9 months. Then from 9 months to 10 months, you go to the doctor every week. And when you go to the doctor, your doctor visits usually include, they check the baby's heart rate. A normal baby's heart rate is between 110 and 150. 110 and 160. Anything over 160 they look at because the baby is really active, and it might be a reason that the baby is really active, so they kind of keep you under a lot of watch. Anything below 10, excuse me, isn't good because the baby isn't fully developing or isn't active as most babies would be. It's the old wise tale that boys are usually 140 and below, between 130 and 140, and girls usually stay between 150 and 160. I have 150, so of course I'm having a girl. And another thing that happens with your appointments is you are given 3 ultrasound appointments, unless there are complications, which is your ultrasounds are determined by your doctor. You also are given vaginal ultrasounds, where basically like a camera is implemented up a woman's vagina. One ultrasound occurs between 6 and 9 weeks, determined to determine the due date, because a lot of women don't know when they actually conceive. So the ultrasound gives them more of a better opportunity to see their actual due date. 12 weeks is when you make sure the baby is developing correctly and check the likelihood of Down syndrome and other birth defects. This cannot tell you like, no, your baby won't have Down syndrome, but it can give you like, more than likely your baby won't have, but you can never know what happens between that 12 week all the way up until your 40th week. This right here is a picture of my 20-week ultrasound, and this is when they measured the baby, told me her gender, and basically saw her movement. This right here is her fetal line, which is basically her spinal cord. And if you can't see, I'm sorry, you can't see, maybe the light probably needs to be off, it's a black and white picture, but this is her head. And like she's in a cuddled position, like so her back is facing the camera. It was funny when they tried to look to see if she was a girl or a boy or not. When they got around to the private area, she turned around and put her butt in the camera. So they had to tell from the back, like, was she a girl or a boy? And the way you tell if it's a girl or a boy, of course, it's obvious. A boy would have some type of extra meat down there hanging, and a girl, she wouldn't have anything. They look for a hamburger line in the girl. Because you know your hamburger, you have the 2 buns, and a patty in the middle, so that's how you look for the girl. Okay. Vaginal delivery is the most common and safest type of childbirth. When necessary in certain circumstances, 4 steps, which are like large spoons, may be used to cup your baby's head and help guide the baby through the birth canal. Those are for mothers who like, at the last minute get lazy and can't take any more pushing, like they really give up. It also is called vacuum delivery. Another way is when they take a suction cup and place it right there at your open area and suck the baby down, but while they guide it with their hand also in you. Although vaginal delivery is the most common and safest type of delivery, sometimes cesarean delivery, also known as C-section, is necessary for the safety of you and your baby. A cesarean delivery may be necessary if one of the following complications is present. Your baby is not head down position, which means it's hard to deliver a baby feet first. They want to deliver the baby head first. Your baby is too large to pass through your pelvis. They do not vaginally deliver 9-pound babies or over. Now, I don't know if they did it back in the day, but right now you cannot vaginally deliver a 9-pound baby. Or your baby is in distress. Some babies don't take labor very well. Even though you might have a healthy pregnancy, but when it's time to push, your baby is tired. He or she just wants to come out, or he or she just wants to relax. So they have to usually go in and remove the baby. A C-section may be planned or unplanned. Reasons you might need an unplanned C-section is labor is slow. The baby, like I said, shows signs of distress, too large to be delivered, head down position. In some cases, women who have C-sections in the past may be able to also deliver their next baby vaginally. Before a C-section, a needle called an IV is put into one of the mother's veins to give her fluids and medicine if needed during the surgery. A C-section is basically a surgery. This is like, if you can see the picture, they make a small incision. Well, yeah, not small, but either this way, horizontally, or this way, vertically, to cut the baby out. Most women go home between 3 to 5 days after a C-section, but it may take 4 weeks longer for a full recovery. And normally they told me my recovery would be 6 weeks after I had the baby if I delivered vaginal, but depending on my C-section, how many stitches I had to have, what happened if I got ripped, anything. And you can get ripped during a vaginal delivery. That means that you're too small for that big head to come out of you. And the aftermath of delivery. This is a woman who's just delivered her baby, and she's holding it. You might not see it right now because she's probably tired, but she's very happy, and she's loving and cuddling her child. The happy times of pregnancy. You can eat all you want. Like, honestly, like, you can eat so much, like, and then you eat this weird stuff. Like, I never enjoyed hummus until I got pregnant, and I eat hummus every single day. And, like, you eat the strangest fruit, like I said, hummus. Like, that was really strange. Like, I eat, like, frosting on my fruit. Like, it's just weird, really weird. And it is a good and a bad thing, because the bad thing is trying to work off all those pounds that you gained through your pregnancy. Last is the happy times is loving the baby. Loving the fact that you brought life into this world and being happy with what you have. In conclusion, pregnancy has as many likes and dislikes, but the joy of bringing life into the world should really put a smile on your face. I take the opportunity of being pregnant as a blessing, and I plan to raise my daughters to the best of my ability. Yes, the labor part is painful, but why wouldn't it be? It's like a watermelon coming out of your nose. Being pregnant has a very blissful and miraculous experience for me. This is something I would never ever regret. I hope I have vividly informed you about the good and bad of pregnancy. Whether you're a male or female, I hope you enjoyed my speech.